Good afternoon, everyone. Good morning and good evening to those of you who may be joining us online from other locations. Welcome, everyone. It's my great pleasure to open today's event. My name is Suri Moon. I direct the Global Health Center here. We're really delighted to be co-hosting together with the Geneva Trade Platform and the World Economic Forum this event, Global Health Challenges: Can Investors and Civil Society Work Together? Before diving into the event and going into housekeeping, I wanted to just say a few words about the title, because you may be wondering, indeed, what is behind this title. And one of the motivations for this particular title is the recognition that generally investors and civil society come from very different worlds, work in very different worlds, and are not often working together towards shared objectives. This has changed in recent years, and certainly in the area of global health, and this is one of the themes we would like to explore. But I think it's useful to put on the table maybe some of the previous concerns that have been raised about the role of investors and how they may influence global health. So I think one of the concerns that we have heard over a number of years, for example, is that this very narrow focus on maximizing shareholder value, on maximizing returns on investment, maximizing profits, has actually led to counterproductive outcomes in health. For example, it may lead companies to be more hesitant to reduce prices on medicines or to license intellectual property, to transfer technology. For example, it may lead companies to push very hard to market unhealthy foods, such as sodas, processed foods, in order to make a maximum profit. It may lead companies to be hesitant to reduce, for example, environmental pollution that can have, of course, very profound and long-term health impacts, including on climate and certainly far beyond that. So coming out of that kind of history of perhaps critique, even antagonism, what we wanted to put on the table was this question of, can investors and civil society work together? And of course, as many of you are already quite aware, investors have also been, at least a key number of investors and an important part of the investor community has been working on ethical investment, what's sometimes called ESG concerns, environment, social governance. And as Nadia has educated me over the years, H is often left out. So we have environment, social governance, but where's health? And I think she's been one of the key people pushing to add H to the end of that acronym, and we'll hear more about that in just a moment. So that's really kind of the background and some of the original thinking as we were putting this event together. We will be looking at the emergence of coalitions between investors and civil society to address a number of global health challenges. We'll be learning from specific case studies. We are learning from practitioners, and hopefully we will be able to draw some lessons that are more broadly applicable beyond the cases that we're looking at today. A few housekeeping announcements before I turn the floor over. We are recording this event, and the full recording should be available within a couple of days at the Global Health Platform website, which is ghplatform.org. We will have a question and answer session at the end of our time, so please get ready to pose your questions and to take advantage of the experts that we have here in the room and each other. Those of you who are online, you can put your questions and comments directly into the chat, and please do let us know if you'd like to target your question or comment to a specific speaker. Last but not least, I wanted to flag that unfortunately at the last minute, one of our speakers is unable to join us. Judith Moore, who is going to represent the World Economic Forum, has had a personal emergency, very unfortunately. And so we very much miss having her here. Certainly they are one of the key partners in organizing this event, but we look forward to having a bit more time to delve into the cases that we have represented with our two esteemed guests today. So without further ado, Nadia, let me hand over to you. Nadia is a senior research advisor working on a research project here at the Global Health Center that focuses on the intersection, actually, of financialization and the pharmaceutical sector. She has a lot of expertise on antimicrobial resistance, a number of other topics, but she is also an experienced finance professional, so brings to the floor, I think, an unusual combination of perspectives and skills. Nadia, over to you. Thanks.
Thank you very much, Suri. I reiterate my welcome to everybody. Thank you so much for coming online and in the room. It's lovely to see many faces joining us to talk about this wonderful topic. Our objectives today in bringing everybody together are twofold. So firstly, we really want to kick off a community of practice around this issue. As Suri mentioned, these coalitions are emerging and having increasing impact in the global health space. And as Suri mentioned, I'm a big advocate of needing more voices and more action in this space. So we want to kick off a community of practice with all of you. We want to build collective action. And secondly, with this community, over the next year, we want to crowdsource a public toolkit for engagement for those who do not have the resources, as you will hear that Maria's firm do, to have a specific person engaging on specific global health topics, to bring in different stakeholders and provide information that comes from this community in terms of how people can engage, how people can build coalitions, how people can ally over time. So with your permission, we will come back to you after the event with the contact details that you've provided us to share how you may be able to join in that crowdsourcing and join in that community. Today we're going to hear from two speakers sharing two different case studies coming from two different angles on engagement on these new coalitions emerging in the global health space. These new coalitions are becoming increasingly important to address the gaps, not only in funding, but also in action, in bringing together policy and using different voices and different evidence bases to push action on specific global health topics. This follows on, some of you may have been at the Building Bridges event last week, which is a sustainable finance conference that's been happening in Geneva for several years now, where for the first time we were kindly hosted to a global health event, and really the social part of the agenda was put to the fore on the last day of the conference. And that has helped us bring community, that has brought some of you to the room today, I believe, so thank you very much. And to kick us off, we'd like to hear from you. So we're going to ask you a question, and we'd like you please to sign in as shown here with the QR code, both the in-person and online audience. And we're going to look at the answer that comes from all of you, the first step in creating community and sharing our thoughts. Which global health challenges do you think would benefit from investor and civil society coalitions? And at the end of the event, after our Q&A, we're going to ask you another question. So while you input your responses, I'll begin introducing our session. So the format today will be two case studies presented by each of our two speakers, followed by Q&A open to everybody, online and in the room. Our speakers today are Bram Wagner, who's Investor Engagement Officer from the Access to Medicines Foundation, which is based in Holland, and Maria Ortino, Senior Global Environment, Social and Governance Manager from Legal and General Investment Management based in the UK. We'll spend a couple of minutes just looking at the results. A clear focus on access to medicines. So thank you, Bram. You're here to tell us how to do that. Pandemic preparedness, which is a new topic and a very key piece of work for the Centre, for our Global Health Centre, and International Geneva, who are focused on this after the pandemic that we've gone through with COVID, with learnings and trying to bring together multiple stakeholders. Vaccines comes from that vein, and UHC, universal health coverage. I think it looks like we've, a few more. But I think in 30 seconds we'll close the poll. And that certainly gives us some starting points, some of which we have already planned to cover and some that we will enjoy working with the community on over the next year. So thank you very much. With pleasure, I'll introduce now Bram, who's going to share the first case study on the Access to Medicine Foundation collaboration on SDG 3.
Thank you very much, Nadia, and thank you very much for the invitation to speak here today. It's truly a pleasure to be here as a person who has a background not in finance and economics, but actually in pharmacy and global health. But my role at the Access to Medicine Foundation is to engage with institutional investors on access to medicine issues. And I know that for many people, it may not be immediately clear how investors can play a role in this issue. So that's what I'm going to talk about today. But first, I would like to take a brief moment to appreciate the words that are currently on the slide here. Access to medicine transforms lives. And an example of that comes from a friend of mine who lives in a high-income country in Europe. And she is dependent on a generic drug, very simple and cheap drug to produce for a mental health condition that she has. And the news reached her that this drug would be unavailable for a period of time due to a manufacturing issue. And she actually phoned me if I would be able, as a pharmacist, to get her the drug and send it from my country. And as a healthcare practitioner, I've experienced firsthand, even in a high-income country, that access to medicines directly influences people's lives. So you can imagine that in low and middle-income countries, which are the countries that we are focused on as a foundation, the situation is actually much worse. So what does that tell us in terms of corporate responsibility? If we can compare a pharma company to, for example, a large tech company, we can see that tech companies generally love to go on about how their products are also enhancing people's lives. And as society and as investors, we do demand that they take their corporate responsibility in terms of climate change, in terms of their supply chains, and also how they treat their employees. But the affordability and the accessibility of their products is not necessarily a demand that we make. For pharma companies, this is different because selling a product that can literally give you the ability to live comes with different ethical considerations than selling a phone or a laptop. And fortunately, many pharma companies and also many investors, as we will see shortly, are already recognizing this. So it's evident that the industry has an important responsibility to also make sure that their products are accessible in low and middle income countries. But access to medicine is a complex and multifaceted issue, and there are many stakeholders involved. And our founder recognized that in order to get these companies to move, it is essential to get all stakeholders on board, including investors. So it has to be a collective effort, and companies can't do it alone, but they do have an important role to play. Next slide. So my case study here today is essentially about how we have grown from a small initiative that was mostly focused on the large R&D-based pharma companies to a real force of change in the healthcare sector, now covering 5 sectors within the healthcare sector, and then also having 2 additional cross-sector programs. And we have been playing a crucial role in mobilizing the industry for about 2 decades now to do more for people living in LMICs. We're an independent organization that doesn't receive any funding from the pharmaceutical industry. And when we started out, our approach was quite unique at the time, 20 years ago, because it involved ranking companies on their efforts to do more for access for people living in LMICs. And this is what the Access to Medicine Index looks like today. And you can see the ranking there in the bottom right corner. And the Access to Medicine Index is an accelerator for ongoing access to medicine activities, but also an inspiration for new activities. And we assess the performance of companies, but also benchmark them against each other and against the industry averages. And importantly for investors, it also contains report cards, which are report cards that have a real company-specific analysis, but also concrete opportunities for companies to improve their efforts. But we are much more than just a research organization that publishes reports. We have the expertise and also the convening power to bring different stakeholders together and have discussions about what is the role of the industry and what is the role of other stakeholders in solving these issues. And just by having those conversations, we are building consensus and we're already making change. And that consensus building is also what informs our methodology. And then we identify specific opportunities for companies to improve, We then track their progress, and we also make sure to highlight best practices so other companies can learn from them. And this is great for the companies because it shows them what society expects from them. And by engaging then directly with the companies, we're also improving buy-in at the CEO and board level of these companies to solve access issues. And importantly, we're also empowering the internal access teams of these companies to drive positive change. And on the topic of today, we're also influencing companies indirectly by engaging with other stakeholders, such as global health organizations, governments, and investors. Now, our signatory base has grown to 138 investors today that are managing 22 trillion US dollar assets under management. And this is a formal coalition of investors that has a clear objective to move pharma companies towards the achievement of the United Nations Sustainable Development Goal 3, which is to ensure healthy lives for all people. Now, the context of the engagement that we do with investors should really be seen in the context of our engagement with all other stakeholders as well. When we are empowering internal access teams at pharma companies to drive change, a discussion that is then subsequently taking place in a boardroom can really tip the other way if shareholders have voiced that they find the issue is important and that they want it to be managed effectively. And we empower investors to do that by supporting them in their preparations for engagements and also their voting practices. And in order for an investor to successfully engage with a company, they do need to understand the issue at hand, and they do need to understand the company's specific situation. And they can't just simply declare that things need to change. And you can imagine that this is also appreciated in turn by the pharma companies themselves, who may get a little bit frustrated when shareholders are engaging them on issues that they don't quite understand or they are not accounting for the company's specific circumstances. So the investor engagement team takes our technical knowledge from our independent research, and we present it to investors in a way that is useful and relevant for them. And we do this, for example, in investor briefings, which are sessions that we organize for our signatories, where we do a real deep dive into the performance of a company and the opportunities that we have identified for them. And this has lots of benefits for the investors as well. First of all, with the platform that we provide, we extend the reach and the influence of the initiative, and also we facilitate cooperation among investors. And this is particularly important for an issue like access to medicines, where systemic change is required, which is clearly the case in a system that we currently have that still fails to deliver access to medicines to many people living in low and middle income countries. And secondly, the expertise that we have built as a foundation over the last 2 decades can complement the internal resources of investors. Imagine you are an investor and you're maybe holding 100, maybe 1,000 companies. How are you going to prioritize and how are you going to choose which companies to engage? And how do you familiarize yourselves with the issue at hand? And our coalition does exactly that by focusing on the most dominant and influential companies when it comes to access to medicines and LMICs. And we also allow investors to pool their resources together and take turns in who is basically engaging what company, and also allowing them to benefit from our expertise. But our collaborative engagement on SDG 3 is not the only coalition that we are a part of. We're also a founding partner of the Investor Action on AMR initiative, which is another coalition of investors that is specifically focused on AMR with a One Health approach. And this is a coalition of investors that is supported by the Access to Medicine Foundation, the FAIR initiative, and also the UK government. And another coalition that I would like to highlight is the ATOM coalition, the Access to Oncology Medicines Coalition. And this is an innovative partnership of over 40 global organizations spanning the public sector, the private sector, and civil society. And in this coalition, we are an independent observer because we do want to keep our independent status from the private companies that are also involved in the coalition. But our role is really to advise this coalition. And again, we do this on our independent, high-quality research. For example, when this coalition was going through the process of determining which cancer products to prioritize, we have shared our methodology coming from our generics and biosimilars program with the coalition, as well as our expertise. And this has then resulted in a list that the coalition can now prioritize in their efforts. So again, we're taking our independent research and we're building consensus in a coalition of over 40 organizations. And then, independent of the coalition, next week in London, we are hosting an event specifically for investors to share the findings of our generics and biosimilar program, which was just launched in September. So we're expanding our efforts to new sectors, and we're immediately making sure to also bring the investors on board in this. So hopefully that has given you a quick overview of how we work with investors and other stakeholders. Thank you very much for your attention, and I'm looking forward to answer your questions.
Thank you very much, Bram. Now I'll pass over to Maria, and she's going to share a second case study of investors working within these coalitions. And she's going to talk about two pillars of her work, which again focus around antimicrobial resistance and around good nutrition.
Lovely. Thank you so much, Nadia. Shall I see if I get this? I am slightly technologically impaired. So there. And as you can see, slides are not my strength. So thank you very much, Nadia, for inviting me, and I'm delighted to be here today. I think for me, this is also a special event or organization, because I am actually an ex-alumni of the Graduate Institute, although that was a long time ago. So I am Maria, and I lead the health team at Legal & General Investment Management. We are, as you can see on the slide, we're a subsidiary of Legal & General Group PLC, which is a FTSE 100 company and insurance business in the UK. Now, what is it that we do? So I will explain what the company does, and then what I do, and then go into more of the case studies. So you might not know, but LGIM, or Legal & General Investment Management, we are an asset manager. What does that mean? And so if you think about, do you put money, raise your hand if you know that you're saving money for your pension. Hopefully some of your employer. Now, that pension is collected by your employer, most likely. Your employer will then hand that money over to, or very likely will hand it over to an asset manager. So someone like the company that I work for, that will manage that money so that you one day can pick up a check on a monthly basis once you have retired. And just keep that in mind when I keep speaking about my example. So what we do is manage our clients' money, and that is investing that money for that pension in the future. What we don't do is, so I should probably first say, the investment is in investing in companies, so buying shares or buying bonds in listed companies. What we don't do is fund, for example, specific projects, fund startups, and that's just to give you an example, so we're not confused with venture capitalists or small micro investments or microfinance investments that are made. Now, how is my company connected with global health and global health challenges? So one of the themes that we work on is a health theme and a global health theme, and I lead that work. And what does that mean? And what does that entail for me specifically? So we focus on two areas. It's antimicrobial resistance and nutrition. Why do we do that? Because we deem these two as systemic risks. What do I mean by systemic risks? So the definition, if you look it up on Google, is it causes a breakdown or impairment of the financial system and negatively impacts the real economy. So that is how it's connected with investments, as in the health issues are connected with the investments. And what do we do, or sorry, I should first say, why do we focus on these and how is it connected with your pension? Now, AMR, and I'm sure many of you already know that, in 2009 caused 1.27 million deaths on a global level. So the antimicrobial resistance was directly linked to those 1.27 million deaths. The cost of not taking action on AMR, according to the World Bank, is an impact that's equivalent to that of the financial crisis. So a decrease of global GDP of 3.8%. And that, so if you think of the financial crisis in 2008, for example, that's the kind of impact not taking action on AMR would have. Similarly, if you think of the COVID pandemic, the impact it had on the financial systems and companies, and accordingly on your pension, that is why we look at these kind of risks. When it comes to nutrition, we look at the interconnected challenges of obesity, undernutrition, and micronutrient deficiencies. The costs of these have been estimated to equal $3.5 trillion on an annual basis. Looking just at OECD countries, the health cost expenditures to those individual countries is around 8% of that. And that is why we look at these two risks. So what is it that what do we do when it comes to these two areas? We use different levers as shareholders or bondholders. And I'll list some of the examples of that. We will vote our shares at annual general meetings. We engage in dialogue with the companies in which we are invested. We speak publicly on our concerns that are related to these two areas. We seek policy changes at a national or international level. Now, this might all feel very abstract for you, so I thought I'd give a couple of concrete examples, and I will start with McDonald's. For the last 8 years, shareholder resolutions have been filed at McDonald's seeking either disclosures or actions connected to their own AMR stewardship in their supply chain. We have supported all of those resolutions and been public that we do support them and why. We have been generally public on our stance on AMR and the concerns we have that. And the reason for us being public is to make it clear to the companies in which we are invested that we're looking at this issue and expecting change in their behavior. We have engaged in a one-to-one dialogue with McDonald's, raising our concerns over AMR and wanting to see change in the company and within their supply chain, that they demand change in their supply chain. And last year, we co-filed a shareholder resolution that was seeking McDonald's to require the entire supply chain apply the WHO guidelines on the use of medically important antimicrobials in food-producing animals. So in a sense, we're using, or not in a sense, we are using WHO guidelines to put pressure on the companies in which we are invested. And I should maybe put in a bracket here. When I say the companies in which we are invested, we are invested in almost all publicly listed companies on a global level. So we see it as a concern for us when certain behaviors are not consistent with what we would be expecting. The reason for that, as I said in the beginning, is the financial implication it has in the long term of the investments. Why do we look long term? Because our clients have a long-term time horizon, and for example, as pension funds do. And so we're not looking a bit what Suri was saying in the beginning, that fast return on investment is we're not interested in that. And you could say we are accepting of that in the short term. It might have, or will likely have, a cost to the investments that we are making, but we're looking at, we're wanting the results on having a long-term horizon. Another example of where we do work on AMR is the collaborative engagement that we do via FAIR, which is a London-based NGO who look at foods, the global food supply chains from various perspectives, including climate change and AMR. And via them, we've engaged with the animal pharma industry with unfortunately some challenges in doing that. But that is another way that we work with our peers in affecting change. And the third example that I wanted to flag to you is with water utility companies, an area that we started looking at in 2021, where we noticed that it was not considered by investors. And the reason for water utilities and AMR is the conduit that water is when it comes to example for pharmaceutical manufacturing, and what water utilities can do, or what we would ask them to do, is both the monitoring of antibiotic resistant bacteria or genes in the water that they manage, and in particular if it's close to a manufacturing plant. We did not, so we contacted and dialogued with approximately 25 water utility companies on a global level. There was very little, I would say, partly understanding, but it was that there was the feedback we got, there's no regulatory requirement for us to do that. So what we decided to do was switch tack, and rather than doing a company engagement, we moved over to a policy engagement, or where we flagged this is a concern to us, and this is where we're seeing gaps when it comes specifically to water utility companies and what is requested of them to do. So we approached various international organizations, flagging what our concerns were and what we would like to see in the future, and the support that we were giving to those international organizations. Lastly, what Bram was mentioning, we're very involved in the Investor Action on AMR initiative together with our peers there. What we've been able to do via the initiative is engaging with or providing our support both to UN action on AMR, so being very public with that, as well as being public and with the G7 finance ministers and health ministers, and where they have acknowledged the support that we had flagged to them, which is quite an important signal that they publicly have said, we see what you're saying and we will take that into account when we are considering actions for the future. I also wanted to mention or highlight what we do when it comes to nutrition, where we work again together with our peers and an organization very similar to the Access to Medicine Foundation, which is the Access to Nutrition Initiative, ATNI, and Share Action's Healthy Markets Initiative. Via these two organizations, we engage with, so that's having conversations with companies in which we are investors, and those are the 20 largest food and beverage companies on a global level. Again, and what we're seeking from these conversations is either disclosure on what kind of strategy they have when it comes to nutrition, their product portfolio, if they are applying nutrient profiling models, as in how they evaluate their full product portfolio and how that product portfolio looks when it comes to healthiness. So there are different types of models that you can use that have been government approved, and we strongly encourage the companies to all A, use these models, and B, disclose them so that we as investors and the public can actually see how their entire product portfolio looks like when it comes to healthiness or lack thereof. We also look at the marketing policies that they have when it comes to marketing to children at various levels, and as well as the kind of targets that they are setting internally to increase the level of healthiness of the food that they are producing. So those are the case studies that I wanted to bring to your attention. I'm more than happy to take questions on this at the Q&A. So thank you very much.
Very much, Maria. So now we'll open to questions, both in the room and online. For our online audience, please write in the chat. There's one question which has already come in, which I think Maria has answered, about collaboration with the FAIR initiative. So I think you mentioned that in your remarks after the question was posted. Please continue to add to the questions. I see some more coming in. And we'll take first question in the room. So there's a mic coming to you.
Hi, Anna Dubell from Policy Cures Research. We run the GFind project. I have a question for Maria. I was just wondering if you could compare the two levers that an investor has. One you've mentioned is the engagement. The other is to sell the shareholding. So do these issues around health ever result in a reduction in your fund's shareholding? Thank you.
Yes, perfect. So that's a great question. Now, the peculiarity of the company that I work for is that we are a so-called index house, or known as a passive house, which means that the shares that we hold in our index funds cannot be sold. The reason for that is that the mandate we have from our clients is that we follow a index. And so in that instance, now there are two, what I think, great levers within that. One is that we don't only have index funds. So we have what's called active funds. In those funds where we hold companies, where we have concerns, those can be sold. So we can maintain the holding we have in our index funds, while at the same time sell off holdings that we have in our active funds. So that's one part, and that's a strong signal to companies. What it also means that we maintain our seat at the table with the company, and so we can continue put pressure on the company to make those changes rather than selling it and another investor pick up those shares. And we use, I would say, all three levers, as in we are an eternal shareholder, we can sell your shares, and we will sit at the table and continue banging on what we think that you change. So for me or for us, we see that as a great advantage rather than saying that we will sell and somebody else will buy them.
Thank you very much. Renato Del Grosso. I'm an entrepreneur and investor in the health tech sector. Congratulations on your, let's say, addresses. I would like to say something maybe trivial, but it's important. So every life matters regardless of the disease and of the geography. Sometimes we forget this, and so as we have heard, there are many neglected diseases, and even in the high-income countries, there is a shortage of drugs that can put at risk patients. So my question is, which are the criteria to select the projects slash initiatives? Can be mortality, can be disability, can be economic impact, in order to create a real alliance among different players. Of course, the role of government is crucial, and to try to sort it out, because I've heard many times in the sector many times that at the global level we want to find solutions. We have resources, but there is not a clear vision on it. So what's your thought about it? Thank you.
Please. Yeah. Great.
Hello. Okay. Yeah, this is a very important point that you make. I can only speak for how we do it. So I've already referred to the consensus building that we do. So for our methodology for the Access to Medicine Index, we go through a multi-stakeholder consultation process where we talk to all stakeholders involved, including academia, governments, the industry themselves, practitioners, healthcare practitioners, people living in low and middle income countries. So it's a really broad consultation. And then in our scope for the index, we have 89 diseases that have been determined on this global consensus, combined with the burden of disease in these countries. And we do, for example, also look at the Policy Cures Research G-Finder to identify specific gaps in R&D research that needs to be filled. So I hope that answers your question.
Thank you, Bram. There's one question online, which is to you, Maria, a follow-up to asking about the whether you're collaborating in coalition with FAIR, to ask about the case that you mentioned of McDonald's and whether there are any more data points that you could share in terms of success on reducing antimicrobial use in the supply chain.
Also a great question, and I wish I had a good answer for that. I think, so data in general, when it comes to health specifically, is very challenging. What I mean by that is the availability for us as an institutional investor to have data that we can use across multiple companies. So we might have specific data points for one or two companies. That helps us with the engagement with that specific company. It's very difficult to then put across it on all companies in which we are invested. Not what I mean that are pertinent to that data point. So I think that's one part when it comes to data. Then when it comes, which I think the question is hinting at, is the impact of the engagement that we do. What's the positive impact of that, or negative? And that's a very long-term kind of gain. So I often compare it to a marathon race. It is, you have to keep your eyes on the finishing line rather than saying, what can I report in the next 3, 6, 12, but even a 2-3 year kind of timeline. And I think that's very difficult to quantify on that. Yep.
Maybe one step was you said that you had put an agenda item in collaboration with some other companies from the asset management industry on the agenda, and then maybe tracking how much that got traction with other investors as you monitored the voting, and whether there's follow-up in the coalitions that you're involved with, maybe specifically on AMR, on the follow-up around that.
No, that's a great follow-up. So there, what's interesting, and for me, looking at it on the increase of support that we received for that shareholder proposal. Now, a shareholder proposal, for it to be accepted or adopted and implemented by the company, it depends on the jurisdiction, but usually you need 50+1% of the votes to support it. We did not get that. What I would say is, so the initial, if you look back in time, the initial support for those AMR resolutions hovered around between 6, 10, some got 15% in the past. The resolution that we filed got up to 20.1% if you include the so-called abstain vote. And that for us was a real success. It might sound little, but it means that 20% of investors that voted actually were supportive of what we were asking the company to do. And what I would be keen, I know there are talks about filing similar resolutions this upcoming AGM season. What I would be keen to see is how does that support increase, and it's seeing that support, which is monitored by the companies as well, both obviously individual companies, but also by the sector. What are investors, what is coming up on the investors' agenda, and where do we need to look at in the long term? So I think that's the positive impact, data point that I would highlight.
Thank you. So I encourage the online audience to continue to put questions into the chat, and take another question from the room.
Yes, no, thank you for the presentations. My name is Evan Lee, and I'm an individual consultant, but tried to convince my company to participate in the ATM index when I worked there. But the question is, how does the decisions of investors, the commitment of investors, or let's say a subset of investors, because the big gorillas are not on your list, Bram. But either of you could take this question. How does that ladder up to influence on the right government regulatory and policy environment to support that so that it's aligned towards shared goals?
That's a great question. Maybe I'll refer to the big gorilla, so to say, first. So I should make it clear that it's not a requirement to be a signatory to work with us, and we do work with anybody who reaches out to us. To your point on policy engagement, this is an area that we're more involved in our Investor Action on AMR initiative. But we do have a government engagement team that can create specific policy briefs for governments and also reach out to our research teams to sometimes do tailored research for governments. So we do try to provide these briefs and also in the government sector try to build consensus on what is needed in the industry, but also what is needed on the policy front.
And if I could add to that, so we have a person or a team that's dedicated specifically to policy work. And so it will be on a global level, but also, for example, we will answer public consultations. So a couple of weeks ago, there was a UK consultation on the National Action Plan on AMR, and we fed in to that consultation and highlighting that investors would like to see certain things, or just indicating that we are supportive of that.
Right. Thank you. Karen Hitchke from WHO Foundation. I have a question to Bram, and this you were mentioning best practices and how you exchange or basically support companies in developing strategies to improve access to markets, low middle income countries, as you said, was your focus. Can you just give a few examples concretely on best practices about disease or a treatment where you were really doing knowledge transfer or exchange between different organizations, or using that best practices to improve overall industry standards?
Yes, so one example I could give is the recent voluntary license for nilotinib by Novartis. So in that case, it's not as much about knowledge sharing as highlighting the best practice itself. So we take that best practice, we highlight it in our research, and also in these investor briefings, we are continuously bringing up that this is a new development where voluntary licensing is being expanded to non-communicable diseases. And we do try then to relate that to companies who are also in a similar position where they could do well by considering voluntary licenses for such programs. And then we also explain to investors that while voluntary licensing can be a great strategy, it's not always suitable for every product and in every situation. So that is kind of how we try to cross-pollinate between best practices, so to say. Yeah. And then if companies do want, and this actually happens where companies approach us and say, we're very interested in this best practice of this other company. Can you provide us with more information how we can, for example, integrate a similar best practice? And that is the work that our company engagement team does.
And that, to add on to what Bram said, that is what we do as well. So in conversations with companies, we will say, well, actually, if we use company X is doing this, we have a look and see what you can do. Because many times, of course, they know what they're doing as competitors, but it's also surprising to find that there are many things they don't look at their competitors and peers what they're doing. And it's being able to give concrete examples is really powerful in conversations with companies.
Microphone will come up to you.
Hi, Preeti Patnaik from Geneva Health Files. Maybe taking the conversation slightly differently. The World Health Organization is exploring a replenishment mechanism, and innovative financing is one of the options being discussed, not in very specific terms as far as I understand. But from an investor's point of view, what are the good metrics that you would look for? What makes a good investment case? If private investors were to invest in raising funds for WHO, what would you be looking at?
Yeah, I think that's this innovative financing as a topic in certainly Global Health Geneva, but more broadly, is kind of a holy grail at the moment, because so many international organizations and PDPs are suffering from withdrawal of funding from governments who are under budget pressures. So the need to replace, whether it's at a small scale or a big scale, in big organizations or small, this need to replace. You mentioned at the beginning that's not exactly what you do, but the seeking of instruments and the creation of instruments to bring money into global health, because we know in the retail investment space, meaning all of us, individuals, there's a huge desire to contribute to improving outcomes, but we don't really have the way as an individual to find a way in. So I think that the two questions, if you don't mind, I add that part onto it, the two questions maybe come together. If we describe a world in the future where we can have metrics and where we can have these avenues and instruments created, how could that look, do you think?
That's a really difficult question. And I'll go back to the point that I made at the beginning. That's not the type of investments that we would be involved in or finance. So I get what I would so if I take from my point of view of saying how could individuals have an impact on investments that are made, I would draw it back to the type of clients that we have. So the pension fund that you seek with your pension fund or your pension fund trustees, what are they doing? Asking the specific questions. What are they doing and asking their asset managers to do when it comes to health challenges? And that question will then come around to us as a pressure point. The other point is also when it comes, I mentioned in the beginning, of voting shares in companies. There's slowly a movement. What's happening is that individual pension funds would like to be able to vote shares that they hold via the asset manager, so somebody like us, and having that kind of access as you as the individual, that could be something interesting to look at. When it comes to what your question was on the specific metrics for a good investments, that would be dependent on what your investment thesis is. So if you look at impact investment, for example, you want to have a return on that investment, so a monetary return, but you also want a social benefit of that type of investments. If your question is specifically linked to health and, let's say, AMR, and what should you be looking at? Should it be an animal pharma company producing less antibiotics, or having applying a certain type of AMR stewardship around the antibiotics that they then are selling to farmers? That would be the type of data points that you might want to be looking at. I don't know, Anada, if you have anything else that you would add on.
Yeah, I mean, I think it's a very particular question, how to fund a WHO, which clearly colleagues of ours have done years and years of work on, but it is a new topic in terms of bringing in new financing instruments and financing agencies, and certainly the whole area of blended finance is building across many of the organizations like Gavi or others in terms of trying to bring in new financial actors to create new ways of increasing funding pools for specific health interventions or funding of the organizations themselves. And maybe take another question.
Thanks very much. Suri Moon with the Global Health Center. I think this is a really fascinating set of cases and experiences, and it's in some ways a very encouraging one. My question is about the scale, and if you could give us a sense of how much of the kind of global investment community, if you will. I mean, Bram, I think you mentioned 132 investors and 22 trillion. under management, and Maria, you mentioned, the assets that your firm manages. But it seems to me, especially when you tell the AMR story and this effort to kind of get more and more investors to care about systemic risks, this is still a relatively minority group. And I'm wondering if you could comment a bit on what are we talking about in terms of the proportion or the scale? I'm more interested in the proportion of investors who do seem to care about health as well as other ESG concerns. Trends you've seen changes over time. Kind of where are we going with this? And my second question is about systemic risks, because I think what we're talking about and what's interesting is the distinction you made between these short-term kind of either venture capital or the sort of hot money that wants fast returns versus a long-term perspective that looks at what are systemic risks to the economy, to society. And I can think of no better example than a pandemic like COVID-19. Clearly, we all know there's no need to explain that as a systemic risk. And yet when I think about the reaction of investors during COVID-19, I wonder to what extent, I would love to hear your reflections on how did the investment community react during COVID-19, during the crisis phase, let's say. Were there interesting bright spots? Were there some disappointing aspects? What does that tell us about that first question in terms of where are we going? Is the investment community as a whole moving in the right direction? How optimistic are you about kind of moving beyond that 5, 15, 20% threshold that you mentioned, in the specific case that you talked about?
Thanks, Suri, for that question. I think, so if we look at health in general and sort of taking a step back from AMR nutrition, or maybe it's better to look at it from an AMR perspective, I think we are where climate change was 10 years ago. So I think we are few investors, which is better than zero, that are looking at it, who are focusing efforts and research on it. And I am hoping that we will have the same trajectory as climate change, as in when you speak, you can't speak to any asset manager, whether big or small, that doesn't have at least one person who's dedicated to climate change. And I would hope that we will see that, let's say, in 3 to 5 years, when it comes specifically to AMR, and perhaps more so when it comes to health. I think that's the one parallel that I would draw. When it comes to the return on investment, would you repeat your question again? Sorry, I just wrote return and then I put. Oh yes, yeah. Sorry. So I would say COVID-19 has certainly helped me in my conversations, both internally with colleagues, to drag, that sounds really bad, the financial analysts and portfolio managers to come onto the page where I am when it comes to AMR and nutrition. I think that it's such an easy example to give and say, well, look what happened during COVID. So I think that is very helpful. I think those first few weeks, when people didn't know what was happening, it was a lot of panic and scrambling. And I think that's across the board, of just trying to safeguard as much as possible of the investments for our clients. I would have hoped, generally as an investment community, that we, and perhaps just generally publicly, that we would take more lessons learned from that and actually work on that today. And I fear, even just on not on a personal, but just on a public level, we're already forgetting what the impact of COVID. And I am unfortunately certain that AMR, a infectious disease or pathogen, will come that will have the equivalent, or if not worse, impact on society. And I would really hope that we are at least a bit better prepared than we were for COVID, and that we take those lessons learned from there.
Yeah, maybe I can add a little bit to that question as well. So I think within the pharmaceutical sector, there is no doubt that the Access to Medicine Foundation is the leading authority when it comes to investor engagement and access to medicine issues. And I've never met an investor that is involved in the healthcare sector that hasn't actually heard of our name. And even pharma companies could make comments like, we're getting so many requests from investors that are mentioning your name. Can you please coordinate it and make it basically become less? So within our sector, it's very much recognized that access to medicine is a very material issue, as we say, for investors. And this is also very apparent in the materiality assessments of pharma companies. Now, when you bring up systemic risks, when the COVID pandemic happened, we have seen an investor response. There have been shareholder letters, for example, on the accessibility of vaccines, where investors came together, wrote letters to pharma companies, and asked for better accessibility in LMICs. And we have seen our signatory base grown a lot during the pandemic, and we also came with our own COVID-19 investor statement that was signed by an enormous amount of investors in a very short period of time. But when we look at the responsible investment community as a whole, we can see that it's unfortunately still very much focused on climate change and the E of ESG. And that is something that we are hoping to change. And we're also actively going to these conferences where we know that they may be climate focused in the first instance, but we still think it's very important that we go and that we get ourselves on the agenda there. And we can see that the interest is growing. And I think the COVID pandemic certainly, and also the growing awareness on AMR has contributed to that, because you can make a parallel with the climate crisis that we are in, where we have seen what happens if we prioritize economic growth above the consequences for the climate. And if we're going to be in a similar situation where we're not prioritizing access in LMICs, where we're not prioritizing funding for AMR and new antibiotics, for example, we're going to be in a similar situation. Yeah.
If I can add an additional point to that, I think what the COVID pandemic helps in pushing the point of the importance of low and middle income countries is that the viruses or bacteria don't have borders, and they don't care where they start, and they will move over to us. And the fact of being able to say, well, look what happened in COVID, and we're not talking about months or years. It took a few days or weeks before it actually happened in high income in countries. And I think that is very unfortunate. That's a very useful example to give, that we do have to care about it.
Yeah, I mean, I think this is comes back to some of the comments you made at the beginning, Suri, about the where's the H? The S doesn't get enough attention, so relative to environment. But one of the reasons why is because in the environmental space, it's much easier to put metrics around things. There are tradable commodities in the E space that, back to your question about, how do we create, which led to the answer about how do we create the instruments and things. We need metrics. The financial world needs metrics to be able to put around new instruments and measurement and impact and all of those things. And that's much more difficult to do in the health space. And we did some work with WHO on that in 2018. We published a couple of reports from the Centre on Banking for Health, where we looked at exactly that topic and how to learn lessons from the climate space and bring those and make them applicable in the health space, because it's a much more difficult space to put this in place. So that's one of the challenges, and where some of the work, for example, on access to medicines, the evidence base is there, which is why you can point to specific examples, and why when you work in coalition with other investors and with civil society, and civil society obviously is also a space that brings up an evidence base and also is a governance mechanism to some of the stereotypical concerns that we have about how do private sectors act in this space. Civil society brings evidence and brings a governance mechanism into these dialogues as well.
Can you hear me? Oh, there we go. Hi, I'm Dina Kirpalani. I'm also at the Global Health Center. I guess related to what Nadia was talking about, we've had new rules passed to the European Union for ESG. How does that type of reform on reporting and mandatory corporate reporting affect your work? And given that the health isn't sort of necessarily always tacked onto ESG, what sort of mandatory reporting or change in the policy and legal landscape would assist you in the type of work that you're doing to influence corporates?
So that type of work is really beneficial to us. The fact of the mandatory reporting for companies, that is extremely helpful. So on a policy level, for example, we I would say constantly feed into that conversation, both behind closed doors, but also when there are public consultations where we say we need comparable and verifiable, consistent, comparable and verifiable data. That is essential to us. Again, going back to what Nadia was saying. So for us, it is positive. There are backsides to that as well, especially when it comes, or not, I wouldn't say it's not backside. I think, actually, no, I would say it's all positive, because the more the transparency and disclosure there are out there, the easier it will be for investors to compare, and also for our clients to compare and pull out those that are saying one thing but doing another thing. So I think that for us as LGIM, we only think that is positive. When it comes to, like, on a national level, we will also, in the UK, there are discussions, there were discussions on mandatory reporting for food companies. Unfortunately, the UK government has taken a step back from that and looking at voluntary reporting rather than mandatory reporting. That is something that we also would be involved in, and where we pushed a lot for the mandatory reporting for companies when it comes to food products. And what it does for us as an investor is creating a level playing field for all companies, what they report or what they do not report, and what we seek from them to report. Don't know if that really answers. It comments more on your questions rather than answering it.
Maybe I can also add a little bit. What we have, for example, noticed is an increased engagement and interest from investors, also due to these regulations. For example, many investors are reaching out to us about, can we support them in understanding access to medicines better, so they can upgrade their funds from Article 8 to Article 9. So Article 8, for example, would mean that their fund is a fund that is promoting sustainability, while Article 9 really comes with more defined commitments and KPIs. And then they come to us and they ask, can you help us can you provide your expertise and help us in getting that arranged? And we're happy to provide that support where we can, because it does then benefit also access.
I'm going to take one last question.
Yeah, my question is a little broader, reading the title again. What are the practicalities of investors interacting with the civil society? And it's not just the burden of disease or mortality or hospitalization, the impact part, but much more broader, because the COVID demonstrated that it's not just the disease, but there are other issues which are important. Bram, you mentioned in the practicality that it's a consensus process that leads to a decision which challenge to take up. Now, if that be so, is that the only platform to hear the non-investor voices? I mean, how is it mainstreamed? I'm not sure if I'm clear about my question, but I'm just trying to pick up from the title, civil society, how does it penetrate into your processes?
How do we incorporate society's views into the questions we should be asking and the issues that we should be pushing, if I understand the question correctly?
Not pushing, but is it really actively involved, or is it just the investors getting engaged and they take into account this as a secondary input?
So maybe if I start, Brans, I would go back to my sort of first or couple of sentences that I said in the beginning of my presentation of, do you save for a pension? And it's that question that the individual can ask their pension trustees of, what are you doing on this issue, and what is our asset manager doing on this issue? So I think that is very much civil society, is not very well aware of that option, but I think it's using that individual voice. A great example of when that doesn't happen is you will have, one of my colleagues was out on the streets for Climate Week a few years back in London, and people who were demonstrating that the government wasn't doing enough on climate change. And so he would ask, do you know who your pension provider is? Do you know where your pension is invested? And so you would have demonstrators on the street who actually were as much invested in oil and gas as any other person. And I think that is, it's understanding your individual capabilities. I wouldn't say responsibilities, but at least where you can have an impact. I think what we do as LGIM is we invite clients, again, but also other stakeholders on an annual basis to feed into the work that we do. So having we sort of sit back and listen to what the concerns are, and that does feed in the long term into the policies that we have and establish. So I think there is I'm not going to say that it's excellent, but I think that is one way of us listening to civil society and specifically our clients.
Yeah, if I understand your question correctly, I personally don't really see it as my role to explain to investors why they should care about access to medicine. That is sometimes, I'm happy to do that when I'm asked, but the signatory base that we have is very diverse. So we have impact investors, we have ESG investors, we have more mainstream investors, we have boutique small investors. So their reasons for engaging with us can be very different. And it could be, for example, we have a few healthcare insurance companies and also pension funds that are specifically focused on healthcare practitioners. They would like to engage with us from a client demand perspective because they know that their beneficiaries really value this issue. But what I think is my role as somebody who has a background more in global health and pharmacy is to provide our expertise and translate it to them in a way that is useful and relevant for them, and what their motivations for engaging with us are then is less relevant for me as long as it's helping people in LMICs gain access to medicines.
Thank you very much. I'm going to close the Q&A. People in the room are welcome to come and ask. I think there was one more question that we'd love to hear afterwards, but I'm going to keep to our timing. So if I just sum up a little bit, I mean, I think we've really heard that when we talk about investor engagement and working in coalition on these topics, it's really about the long-term issues, and that's where we can really see the power of bringing these coalitions together with the input of civil society, to your previous question, on what should be, priority setting in this space. And it's no surprise, therefore, that antimicrobial resistance, which is such a problem that's so complex and needs actors from all spheres to come together, is something that we've heard from both of our speakers today. I think we've also heard what investors can do apart from invest, what role they can take in this space. We've heard the role that civil society takes really in governance, in providing good governance in this space. And we collectively look forward to working with you as we work together on building out this community and building inputs into a toolkit that we want to crowdsource over the next year. To close, we're going to ask you to take part in another question. So if I could ask for this to be put up, and we welcome responses from both in the room and the online audience. While you do that, I'm going to thank our speakers very much for coming today. You've given us some really specific case studies and some really specific evidence building spaces, which is, as we just touched on, so incredibly important in this space. Thank you very, very much. I'm going to hand over to Suri to close and give us a few extra pieces of information about forthcoming events from the centre. Thank you very much.
Or they can come up while I'm closing the event. So first, thank you so much to our two speakers, to Bram, to Maria, for joining us and sharing your experience and wisdom with us. I think in my own work, focusing on access to medicines, as you dig and dig and dig and what can change company behavior, you always end up looking at investors. And so for better or for worse, we know investors are very powerful, and I wish you luck in changing the role that investors play in governing businesses, actually, in their contributions to global health. Let me also thank Nadia, who has taken a leadership role in organizing this event, and together with our colleagues at the International Geneva Global Health Platform, Ellen, Gia, Negar, and Bettina Zago. Thanks very much for all of the hard work. It takes a tremendous amount of work to put together an event like this, so congratulations and thank you. I did want to announce our next event, which will be happening in about 2 weeks from today on October 25th, which will be online only. Decolonizing Global Health from Discourse to Practice, and we'll be looking very much at, again, as we did today, specific practices that have been implemented that a number of key practitioners have put forward as positive and informative examples of how you actually implement calls to decolonize global health. For those of you who have joined us online, thank you for your active engagement. For those of you who are here in person, I'm delighted to invite you to join us for a reception downstairs. I believe so, kind of as you leave, turn to the left, you'll see a set of stairs. We have a tremendous amount of experience and expertise and creativity in the room. We hope you'll take the opportunity to mingle with each other and with our guests. And with that, let me close the event. Thank you very much.